to another episode of Healthy Talks. Today we are with Ilda, who is a nurse and midwife here in Australia. Hi, Ilda, how are you doing today?
Hi, I'm good, thank you.
I'm so happy for you to join us. I'm really excited to dive deep into your experience and your background and seeing what insights you have to teach us in the healthcare industry. So you've mentioned before that you've worked in both public and private healthcare sectors for nearly 10 years.
Yeah.
What are the biggest lessons you've learned from each and how have they shaped your approach to midwifery?
I think the biggest lesson from public would be to expect the unexpected, only because you never know what's going to walk through the doors.
Mm,
And they have such a high number of patients. And so, it's in relation to that is time management. So you have to manage your time really, really well because, again, you never know what's going to walk through the doors. Not only that, there's a high number of high risk patients also. So I've, learned a lot of time management skills
mm,
over the years, which is, yeah, been good. With private, the biggest lesson is to slow down and to actually enjoy the journey because you get more time with the woman and her family. They have a longer stay, and so it's, yeah, just learn to slow down a little bit and enjoy
that's
that.
right.
So, but I treat every woman, according to her needs, her wants, her background story. So that's probably the biggest like approach that I've got to my practice now.
Okay. And you mentioned the diversity of patients in the public sector and the skills you've gained. Could you share an example of how these experiences have influenced your patient care?
Well, I've learned a lot of like social skills only because I feel like I had kind of a sheltered upbringing. So going into the big wide world,
Yes.
I realized what was actually out there. And the biggest thing is social skills.
Mm,
I've learned how to approach people from different backgrounds. So we have, there's high amount of patients at the moment exposed to domestic violence. So I've learned how to approach those situations.
yes.
And, anyone with disabilities, refugees. Um, yeah, so I've been able to, yeah, develop those skills to provide the right care for them. Um,
That's right.
yeah, so that's so working with, social work, child
Mm,
protection, all these other, you need to provide them extra education. Sometimes they need a
yes.
lot more support, especially in having a baby. So,
Yeah, I
yeah.
can only imagine. And in your opinion, from working all these years and in all these diverse sectors, what are the most significant challenges for midwives in the private sector versus the public sector? And how do you manage these differences in your daily work?
I would say for the private sector, the challenges can be like nurse to patient ratios. So I know not all private hospitals, have relaxed ratios, but some of them do. And so sometimes a midwife can be looking after more than the four patients that she's,
Yes.
usually allocated. So that can be a challenge, and that's also due to understaffing. Um, but they actually have a lot of similarities. So public also have a lot of understaffing issues, um, but they are a bit more stricter with their ratios. So
Okay.
yeah, I would say, yeah, understaffing is a big one. I would say maybe underfunding too, especially like
Mm,
public sector. Obviously, need money to have staff, so
yes.
just you can pay your staff. Um, and I would say public, there are high booking numbers. So a lot of women that are booked in at the beginning of their pregnancies to have their baby at a specific hospital, there are a lot of them. So then obviously we have high number of patients, not enough staff. Um, And yeah, and yeah, like I said before, a lot of them are high risk, so that becomes a big challenge.
Mm.
Um, yeah, I you just have to adapt to the different acuities,
Yeah.
especially yeah, public. Yeah,
Educate, communicate, and adapt.
yes.
And you said mentioned before that midwives in the public sector have to be more hands-on. Could you explain what skills midwives in the public sector might develop that aren't as common in the private sector?
So in the public sector, midwives, I would say, especially in birthing area, so birth suites, they tend to manage, spontaneous, low risk labors from start to
Yes.
end on their own. Don't really need to consult a doctor. Um, and then they also, even if just say they were inducing labor, midwives can develop skills to actually start the induction, like inserting different devices and stuff to, you know, start the process. When,
Mm.
normally in the private sector, the doctor does everything from start to end, including the birth. But midwives in public can do everything from start to end, even though it's obstetric led.
Okay.
You get what I mean? Yeah. So in public as well. So as long as, everything's going well, midwives actually are the main accoucheur at birth as well. So yeah, it's different in public. You would do have to do a lot more, which
Mm.
is, is great. So you get those skills as well. But in private, like they they they're paying the obstetrician to do it all. So that's, fair enough, you know.
Yes.
So um but midwives still have a really important part in private. So we are with the woman and we are with them from start to finish. And you are able to be more present with them during their birthing experience. You get to be by their side, fully supporting them. So that's also beautiful.
I'm assuming that it's not just a physical type of being there, but also emotionally for them during the birthing process.
Yes, definitely. Definitely.
And with healthcare affordability becoming a growing concern, especially in the private sector, what are your thoughts on how this is impacting patient care and the midwifery profession as a whole?
Um, I think less people can afford private health insurance at the moment. And then for the number of bookings in the public system it goes up, obviously. Um, so there's more pressure on an already struggling healthcare system. And, you know, in public, they get 1 to 2 nights stay, and they're discharged, within 24 to 48
Oh,
hours. And some of them are having their babies for the first time. Like, it's a lot to do. It's a lot to
mm,
educate, and it's really tough when sometimes we don't want to send them home because we think they need more support, but we also need the beds.
yes.
And that's horrible. It is horrible. And, wish there was another way. But it's just too quick for discharge. It's just
That
too
must be
quick.
tough on you as emotionally as well.
Of course, of course. And we are just so, so, so busy because, in public we have a 1 to 4 ratio. So it means we look after 4 women on the maternity ward, but that doesn't include their babies.
Ooh,
So we still have to do so many things for the babies. So temperature, heart rate, respirations. We need to monitor their output, make sure they're feeding well. We've got to do, weights and all these things, but they're not included in our ratios. And so it's it's hard having 4 patients already plus their babies,
mm,
and then having to do all those things within 24 hours to get them out the
it's
door
a lot.
and make sure that they're happy to go home and they're okay at home. And then you have the community midwives, so domiciliary midwives, going out to their home to make sure they're okay. And then they run into other problems because they were discharged so early. So, so it's just a cascade. It starts a cascade of events sometimes. Yeah.
No, definitely, I can imagine so.
Enjoying this episode? Ever thought of starting your own podcast? Podup.com is your go to. They've got everything you need to run a pro show, including 35 or more AI powered tools for success. Sign up today for a free starter account and get 15% off with the code HealthyTalks15. The code is HealthyTalks15. Plus, check out podallies.com for a done for you podcasting experience, complete with website, social media, and editing. Start now and let's launch your podcast together.
You mentioned earlier that you have a great interest in domestic violence survivors due to cases you've encountered as a midwife. How do you see yourself integrating this with this passion of your midwifery work in the future?
So I feel like I'd be able to communicate better with patients, educate them better, integrate more services. So there's a lot of services out there, community services, even like Australia-wide services that can help them. But having that extra
Mm,
education to be able to educate them and to help them is going to be amazing. I'll be able to, recognize the signs of domestic violence a lot better. Um, and yeah, just know the steps, to get them on their way
that's
and to
right.
make sure they're safe and make sure that their babies are safe also and are, well cared for.
That's right. And juggling shift work and caring for your 4-year-old, you mentioned it before, sounds
Yes.
incredibly challenging. How do you
Yeah.
find balance and what advice would you give to other working parents in healthcare?
I I only work the shifts I know that I'll be able to. Having my husband working as well, then having our 4-year-old who's obviously not in school yet. It's
Yes.
hard. It's been very hard. But yeah, only working the shifts you can. So if you can only do weekends, do weekends. Don't take on more than you can't do.
Oh,
And that's
gosh.
going to stress you and your family out because honestly, it's not worth the stress in your family life. Like you need to be a 100%. You can't pour from an empty cup. If you can't do it,
Mm,
don't do it. You need to be
that's
there for your
right.
family. Yeah.
You need that support system as well. Like you mentioned, your husband is there, but he's also working. I can't even imagine doing a job and having a 4-year-old running around at the same time.
Yeah, it's hard. And shift work is not family friendly. So there's not many positions out there that are, within school times, especially midwifery. Um, yeah, so it can be very hard. But yeah, like I said, you do what works for your family. And if you can
Yes.
get a position that, allows you to work within school hours or only weekends, or if you can do night shifts, it's great. Great. Do that. Yeah.
So when do you sleep? Never.
Uh, well, I'm fortunate enough not to have to do night shifts at the moment, so I can sleep at night if my son allows me. Yeah.
Very good. And looking back at your initial interest in pursuing a trade like hairdressing, how do you feel that shift to midwifery has impacted your personal and professional growth?
um, well, I feel like I'm in a career where I'm actually fulfilled. I feel like if I went into a trade like hairdressing, I think I would be happy at the start, but then sort of I need something else. Like that's just me and my
Mm,
personality. But I feel like I'm in a career that I can progress and I can go further up or I can branch out. So like I've always wanted to. I'm that caring type. So
yes.
being able to help people and just especially through pregnancy, child's birth, it's always been an interest of mine. I just wasn't in school. It took me a long time to actually click and be like, okay, I can do this and
Yes.
I don't have to give up. And so once that kind of clicked over in my head, I just really, really tried my hardest and I got there. Um, but I just don't feel like I would be as happy. But that's just me, and I've
You found
love
your
hairdressers
passion.
and everything. Yeah. I found my passion. Yeah, yeah, definitely found it. So, um, hairdressing I don't think was a passion. So I think I would have done it just so I could leave school. um, but I'm glad I didn't. I'm glad I didn't.
And you've spoken about the pressures on the public healthcare system and how they affect postnatal care. What improvements do you think could be made to ensure mothers receive the support they really need?
I think like everything comes down to money. Like we need the extra
Funding.
funding. Everyone needs extra funding. And extra hospitals. I know is a big ask, but there are so many, like there's not enough hospitals in certain areas, and the areas are expanding, like they're getting more populated, and so the hospitals are just being absolutely crazy busy because too many people, there's so many people around, and the hospitals can't hold them. And so we need extra hospitals around just to take pressures off the existing hospitals.
Mm,
And there's needs more education, more breastfeeding support. We need more lactation consultants around. There's a lot of there's so many women that want to breastfeed, and like they come into so many issues. Um, and it would be great to have the extra support around. That would be amazing. Um, yeah, and also mother crafting skills. So like if the mothercraft nurses could be around again, that would be great. Just to
what is a
help again.
mothercraft course?
A
Nurse, a
mothercraft
mother.
nurse is it's someone that helps with, like the feeding, the changing of the nappies, the bathing,
Ah,
that
okay.
kind of stuff. It takes a lot of pressure off midwives as well. Um, yeah, like that would be great. I know there's a couple still around, but if we could introduce that again, that would be a big, big relief, a big help. As
Definitely.
Yeah. And just going back to breastfeeding support, like access to lactation consultants, like outside of business hours and on weekends and things like that. So that especially like, if a woman's being discharged, 24, 48 hours after birth, it could be on the weekend. They didn't get to see lactation consultant. And even though they get to see them as an outpatient, like, getting it done faster so that their breastfeeding journey doesn't get tainted by other things.
Mm, and
um, you know,
halted.
yeah, that's right. So it's just, need funding, need just extra supports all around, I feel.
Because all these babies are being born, but you're not getting the extra support that you need.
Yeah, I feel like, and that makes us midwives feel a little bit burnt out, I think. Like we get burnt out because it's a lot to take on.
No,
And
I can
if
imagine.
you're doing a discharge, there's a lot of work to do, especially if they only birth the day before. We've got huge list of things to talk about for education before they can go
Mm,
home. There's so much. You've got to check both mum and baby head to toe. There's a lot of paperwork to fill out. There's just a lot. So
a lot to do.
a lot. But it's worth it in the end. Like the whole job is worth it in the end. It's I don't see myself doing anything else. But I
That's
think these
amazing.
things will help
Yes.
midwives, but it will help the mums and their babies.
And that's
That's what I
essentially what you need is just that help, that support.
Yeah, that's exactly right. That's exactly right.
And for my last question of you, Ilda, today, looking ahead, do you envision staying in the clinical role or would you actually consider expanding into leadership, advocacy, or even policy making to address some of the systematic issues you've encountered?
I would consider I would consider a leadership role. Um, it's like in the future. Um, Policy making, I'd love to get into as well eventually. Um, I probably want to sort of have a step up in a clinical role first.
Mm,
So probably, midwife specialist kind of role first. I'd love to get into education at some point too. I love educating the student midwives and medical
mm,
students that come through. It's always fun. But yeah, policy making I love to get into. I just want to make sure, there's the safest care possible, the most recent evidence-based policies,
mm,
so
definitely.
that's ensure safe care. Yeah.
Well, you sure do have the wealth of experience and you have the passion for it, so I'm sure that is
Yeah.
something that you can see in the future.
Yeah. I hope so.
Well, Ilda, thank you so much for your time today. It's really been interesting to hear the differences between public and private and just what a midwife in the public sector goes through. I don't think anyone actually realizes how much you go through and how much you do. So it was very good to hear, and I hope that our listeners also get a little insight into that.
Yeah, no problem. Thank you for having me.
And for all our listeners out there, remember to like and subscribe, and we'll see you on the next episode of Healthy Talks.